Opposed? All right, we're ready to move, Mr. Clerk.
Next item C, unfinished business. There is none, Chairman.
Yeah, there we go.
Next item D1 under new business, approval of a cooperative agreement.
Okay. All right, thank you. Yeah. Okay. Who's introducing this?
First.
Yep. So, name and title for the record, please.
Carol Osterberry, Health Officer, Health, Human, and Veteran Services.
Good afternoon, and what are you bringing before us today, Ms. Osterberry?
Yes, this is for approval for a cooperative agreement between Wayne County and Brogan and Partners Convergence Marketing. And Brogan and Partners will be conducting the media education outreach campaign for medical marijuana. And as the agenda says, this is one of the few times when we received money that is for all of Wayne County, including the city of Detroit. So I can tell you when this all first, came to us, we already have started meetings with the Wayne County or the city of Detroit Health Department, for their ideas on the exact final the locations as to where all the ads will go. But like I say, this is something that usually I'm sitting here saying yes, 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 but excluding the city of Detroit. This is one of the few times when we actually have the money for all of Wayne County.
Okay. You used the term cooperative agreement. What does that mean?
That was the guidance from the procurement office as to what we would need to do to be able to procure this money. The exact words from the procurement administrator, she said, you don't have time to go out for an RFP. You need to do a cooperative agreement. And then procurement helped me find Brogan and Partners. So it was all done in accordance with the procurement ordinance. But this money came to us beginning of January, and it has to be spent this year.
Came to us from where? Who's funding this?
Lara, the state licensing, I can't remember the AR.
Regulation.
Thank you.
Yep.
Yeah.
Yep. They're footing 100% of the bill on this, the state?
Yes.
Okay. Do you have something, Council? Okay. Questions from commissioners on this? Yeah, Commissioner Marecki.
Carol, so you're in partnership with Detroit then? Everybody's
Yes.
deciding what to do
Yep.
with this?
Like I said, it's kind of exciting. I mean, I work well with the City of Detroit Health Department folks anyways, but I'm excited about, really, it's one of the first grants I've ever had to work with them, so I'm
Right,
excited about it.
okay. It's only a year, right?
Correct, yes. Everything will be rolling out and, yep.
And what's the thrust of the campaign? You're all over media with this. What are
Right.
Well, what are the billboards going to say to people? Or
We haven't gotten down to that
what
final.
is the kind of information we're passing along?
It's information on, the uses of medical marijuana. A big piece is the displaying the myths and the facts. I know there's a lot of myths with pregnant women that, taking medical marijuana helps with morning sickness, and the OBGYNs are very much know that's not, a good way. So certainly through the WIC clinics also, that's going to be for both ones in Wayne County and the city of Detroit, we'll be able to use, both of that is a good avenue for pregnant women. It will be, and I just went blank. You can say,
Yeah, it's not good for memory either.
right. I'm sorry.
Well, I would imagine a large percentage of the American population has a lot of theories out there.
Yes, the research I've been doing, gearing up for this, I think there's a lot of myths versus the facts of, the real medicinal benefits of medical marijuana.
So we're going to be the adults in the room.
Yes.
Okay. Any other questions on Commissioner Anderson?
Just, this is one of the few times, if if ever, that I've seen a cooperative agreement. There's not many, but this meets the requirements of the county as far as contracting and having open bidding and.
Let's let council handle that, please.
Okay.
Well, council will start by saying that I don't recall this specific agreement, but we do have cooperative agreements, and they're not unusual, especially for like COPS and DPS, where we will purchase off of someone else's RFP process or solicitation process. For example, My Deal. I don't know the cooperative entity in this particular instance, but is My Deal? Oh, it is My Deal. So where we are purchasing off of something that the state solicited, which again is not unusual for us
I
to do.
didn't realize the state.
So that probably means it includes all the other counties in the state as well. My guess would be, do you know? With My Deal and that?
Right. I don't know the real specifics. I just know, like I said, because I was kind of the same way. I've never done a cooperative deal, and I did this with close guidance from procurement.
Okay. That's good. Commissioner Anderson?
I'll move approval.
Oh, okay. Commissioner Baker McCormick, you wanted in on this.
Thank you, Mr. Chair. For clarification, you talked about the health related advertising and related to health, but is it going to talk to the laws and where you can smoke, how much, and all of that?
Right. I just don't have those details. I think it's more because it's coming through, the health department. But yeah, as far as and where someone can purchase
all of that,
and what they need, that certainly will be part of it.
Medical marijuana and
and this is just for medical marijuana.
Right.
That's all this can be used for.
Okay. Yeah, because I think it's important to somehow talk to that, because I'm not seeing anything out there about the ins and outs of use, legally where you can.
Right. Well,
So-
I'm trying to think. Is it almost 10 years ago that the state adopted, the voters voted in medical marijuana?
For
It's been a
medical,
while.
yes.
Right.
Right.
Yeah.
Right.
Yeah.
But you don't really, I don't see a lot of
No, and I don't
that.
either. So
And so that's why I wanted to see if we could look at somehow including some
Right.
of the laws around it.
exactly.
Yeah.
Yes.
Okay.
Yep.
All right.
But this is, again, relation to medical marijuana, not what the voters did a year or two ago.
You are correct.
So the money is not intended for how much can you grow at home, how much can you be in possession of, where can you, what if you get pulled over. None of that is being discussed here. It's just around the medical marijuana.
Correct. Just
And
the
that's
medical
what the
marijuana.
grant is for.
Yep.
Okay.
And then, this doesn't really have much to do with this, but I asked about the dental program, because we do have funding for dental, for Detroiters, right?
Right, through
Okay.
the FQHC, and I talked to Tom we can talk after the meeting, but Tom Coates just said that he had been in contact with you, so,
Okay.
okay.
All right, thank you.
But actually, let's handle that under the other matters
Okay.
when we get there, if we can, just because I'm interested in that conversation as well. Commissioner Anderson has moved. We're looking for a second on this item. We do have support on this item. Are there any further questions for administration before we go to a vote? Hearing none, all in favor of the motion, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Thank you, Ms. Osterberry. We'll see you in a sec. What's next up, Mr. Clerk?
Item 2, approval of a sole source contract with Lodox and ALLC.
Okay. For a full linear x-ray machine over at the medical examiner's office. Who's introducing this? Yeah, the MEO himself. Please remind everyone of your name and title, sir, and then we'll go into what this contract is about.
My name is Carl Schmidt, and I am the medical examiner for the county.
You've been doing that how long, Dr. Schmidt? Yeah, you got to hit it one more time. It's kind of screwy. Yeah, see? Say, yeah, have faith.
As chief medical examiner for 16 years.
And had you worked in the MEO's office in Wayne prior to that then, too?
I have been there since 1994.
Holy cow. So what do you need, a full whatever x-ray?
Well, we already we have one. This is an upgrade to the one that we have now that is reaching the end of its service life. It is an indispensable piece of equipment due to the kind of
To
caseload
say the least.
that we have. The one that we have is now 10 years old, and we got that refurbished, and it's needed to have the x-ray head replaced twice, and the software is reaching the point where it's going to be harder to upgrade. So this is just a new model of the same machine that we have now.
And that's why it's a sole source?
Correct. It's a linear x-ray scanner. No one else does something like this.
Okay.
And it allows AP as well as lateral views simultaneously, which is actually indispensable for locating things like metal fragments.
I like it when we talk things like that from my science background, lateral, yeah. Okay, and this is both hardware and software that we're purchasing?
Yes, yes, it's an X-ray scanner. It needs software to put together an image. So the machine as well as the service contract include service for the actual moving parts as well as the software itself.
Okay. Okay. 400 grand, that's the going rate these days. Go ahead, Commissioner Anderson.
I'll move approval.
Support.
And it's been supported. Are there questions?
Yes.
Commissioner Baker McCormick.
Thank you. Nice to meet you. Can I come over one day and just
Sure.
take a tour? And I've not, well, this is our first time meeting, but I would love to do that. So I don't know if any other commissioners have
Interested.
been.
Yeah, maybe we can set that up. I know you've done that before.
Yes, you've actually had subcommittee meetings in our office.
We have.
In the
Oh.
past.
Yeah, we have. That probably goes back, probably at about the time when we were doing the conversion to the University of Michigan. I think we had a few meetings then.
Right.
And you'll love the viewing room. Nice big windows and an array of bodies out there in various states of dissection or whatnot. It's, yeah. Just as a reminder, because, and I just brought it up, I think it's 5 years ago now, we went and had a contract with the University of Michigan to do the management of this office.
The first one was in 2011.
2011. Oh, was that far back?
Yes, and the third renewal was 2 years ago.
Okay, so we did a 3-year and then another 3-year.
Correct.
And now we're on, how far in, this is a 5-year renewal that we're in?
This is year 2 of the 5-year.
5-year renewal. Okay. Little while before it gets to us, but yeah, I will. My office will set up with your office. We'll get a time, and then we can invite commissioners to come over. Not just on this committee, but other commissioners might be interested in seeing what's going on over there.
Sure.
Beautiful. We're not keeping bodies in trailers anymore, refrigerated trailers.
No.
Yeah, there was
It's
a lot
been a
of,
while.
yeah, there was a lot of upgraded that were needed. My understanding was that building was built on Florida specifications, and it hemorrhaged
That's right.
energy like crazy. So we had to go back and redo a lot of that in the building. Yeah. And when we come over, we'll talk about unclaimed bodies and that kind of stuff. I think the commission would be interested in knowing what kind of an inventory you're carrying, because nobody showed up for the bodies. But we'll do that another time.
Okay.
For this motion, we have a motion and a second. Are there additional questions of the medical examiner's office on this? Does not appear to be, so we'll go to a vote. All those in favor of the motion, please say aye.
Aye.
Opposed? Any abstentions? All right, good to see you, Doc. We'll set that up.
Thank you.
Thank you for your work. vital work that's being done. Mr. Clerk, what's next?
Item 3, discussion on the impact of budget adjustment.
Yeah, there's only 2 of them here, and I got a little confused. Did the Senior Alliance, that came through this committee, the 46,000 grant additional? Or did that just go to Ways and Means? That's the first item to review, $46,000 in revenue to go to the nutrition fund at the Senior Alliance.
I saw it.
But anyway, we have additional, because I thought we talked with about the Senior Alliance last time, and there were no waiting list or anything. Mary, you have
Through the chair, we approved the contract for this amount back on June 20th as the full board.
at the full board. Yeah. So it probably came through Ways and Means as a budget adjustment then, and then went to full board. Okay.
Got it.
Contract came from here.
The contract was here? Yes. Yeah, okay. So everybody up to date on that one? And the other one this time is just a $2,300. Reallocate funds. Just lines in the budget. Take a little out of here, put a little back there where we need it. Any questions on that one? So we'll probably go like another month or so, another couple of meetings before we look at these budget adjustments. I know a lot of times we don't have questions, but I think it's important for the committee to know the pluses and minuses that are taking place and, you know, just how the money is moved around. All right, we'll move the agenda then. Mr. Clerk, what's next?
Item E, such other matters as may be submitted before the committee.
Do you have one, Mr.? Okay, then we'll invite Ms. Osterberry back and let's talk about what the issue Ms. Baker McCormick raised. If you'd like to reintroduce that, Commissioner, and then we'll go from there.
Thank you. Again, we talked about the dental program that we have, and I just wanted clarification on how the funding or where that program is right now and how we can get our constituents some of those services.
Right, that's all through the federally qualified healthcare clinic. And the funding comes from the federal government, HRSA.
Correct. Yeah. Dave,
I'm not.
Dave Brooks, director of the department. As Carol's mentioning, through our federally qualified health clinics, FQHCs, you've heard that name sometimes, we have 2 locations. The Wayne location, actually at Carol's building in the health administration building, has a full dental suite. So that location is open to any person in America, anybody in U.S. It's federally qualified to come to for dental care. No one is turned away regardless of their ability to pay. That's part of our grant from the federal government. We are working right now, and it's staffed, by the way, that location is staffed by University of Detroit Mercy Dental School. So both dentists as well as students rotate through that location. We are working right now with U of D Mercy as well as through a state grant to add dental services at our Hamtramck clinic. That hasn't finalized yet, and obviously once it is finalized, if it's finalized, it'll come forward here, as well as we'll have some time it'll take to build that out. All of it would be, if it happens the way it's currently being considered, all of it, all the equipment and the support to it would be paid for by the grant. So there wouldn't be any county money, but it would add a second location. At this point, we only have the one location in Wayne, Michigan. But again, that's open to anyone to come to, no matter what the residency, city, county, even other county residents and other state residents from other states are eligible to use that location.
Okay, and what type of services, and is there a income, qualification or?
I think it's pretty comprehensive
Right.
from what I understand. I mean, I know they're doing even like extractions there.
Right. Extractions, fillings, preventive dental, normal dental work, that type of thing. I don't think they do any type of dental surgery or anything like that at that location.
Braces or
I
anything?
don't think
I
so.
don't think they do any orthodontry.
Okay.
But
And then
everything
again,
you would
any means of payment is accepted So if they have dental insurance, if they have Medicaid, great. They're obviously their insurer will be paid for. If they have no means to pay for it, we would accept them as well.
Okay. So what I wanted to get from you is what you just said in writing, in
Right,
a
yeah,
brochure, pamphlet, something we can disseminate.
Right.
Yes.
And that's,
Yeah,
yeah,
we-
we'll
right.
touch base again with Tom Coaches,
Great.
the director.
Tom's the director over
Right.
at 2 FQHCs.
Yeah.
And this
Okay.
falls into that area. So we'll get you, if they don't already have a flyer, they can easily produce something that summarizes these.
Okay,
But I think they
great.
already have something.
Thank you.
But it's the services available in any regular dental office that anybody goes to.
General
Right.
dentistry.
Not the stuff where your dentist says, well, go over here for
Yeah,
your
not
root canal or
endodontally or
go over here for your
orthodontics.
braces. Okay.
Right.
Are you also aware of,
Oh, yeah. Is it by appointment or you just walk in? I'm sorry.
go right ahead.
It's by
By
appointment.
appointment, I know someone came to our door and said, I need some help with dental, and it's not like we sent them away, we sent them around to the clinic. So I think, again, that walk-in is obviously based on the available, they're busy, I will tell you that. Whenever I go back there, they are busy, but yeah, certainly walk-ins are, they try to fit them in.
Okay. And the address of the Wayne location?
Sure,
Do you
building.
know? I guess it,
Van Born and Howell Road. Or
Yep.
is it Vinoy?
Vinoy.
That's an
Vinoy.
intersection,
Yeah.
not an address.
is it
33030 Van Born Road. And it is, like Commissioner Anderson was saying, it's on the corner of Van Born and Vinoy Road.
okay? And so that's in
That technically is Wayne,
Oh, Wayne. Okay.
I think right across the street.
Find Metro Airport and go north.
Right.
Okay.
A couple of miles.
Yep.
Okay. Great. Thank you.
Are you also aware through your office of dental services available in the city of Detroit? Because, the county in general is underserved by primary care physicians as well as dentists, and that problem gets much more difficult in the city. We've had people from the juvenile detention facility come here and say, we get a 16-year-old, first time anyone's ever looked in their mouth is when they wind up at the juvenile detention facility, and you wouldn't believe what we see and don't see in there. Are you aware of other dental services that the city of Detroit provides? Like, there's a dental thing over here on Gratiot with St. Vincent de Paul. They have so do you guys have that information too?
I think we could check some sources. There are a number of low income or charity care dental clinics, both in the city as well as in other suburban areas in Wayne County. I know U of D Mercy usually is involved with most of them.
Yeah.
So it wouldn't surprise me if they don't have some type of central clearinghouse of how they.
Is that something you can
We can
look
check
into?
Yeah, we have contacts at U of D Mercy, so dental. We can certainly ask them if they already have various materials available for low and no income.
What, Vinoy and Van Born? Long way from
Right.
Right.
Well, that's
Commissioner
That's
Baker
why.
McCormick's district, and she's a west sider, I'm an east sider. We don't even know those streets exist.
also part of the reason why we're trying to hopefully be able to develop the service eventually at our Hamtramck location. It'll
Yeah,
serve
it's
a little
needed.
bit more of the central community. In the county.
But if you could see what is available in
I will.
Detroit,
Yeah.
and I'm not going to get into it here, but boy, do we need more FQHCs for this county to be the sponsor of, or whatever that term is that the feds use. Commissioner Anderson, you had something on this?
I would just ask that if you could find out if there's a brochure that has other services too. I don't know if that's what you were asking for, primarily dental, but I think there's a number of other services that are available to people.
The FQHC, right.
There's probably one for the Wayne and one for the Hamtramck.
Correct. Oh, yeah, they have information flyers. Right.
Okay.
I can make sure we get the general flyer to you as well.
Okay.
That's easy.
Thank you.
Yep.
Commissioner Baker McCormick, you had anything else on this?
Well, this has to do with the veterans. We're still addressing.
Yeah, we're still on
Right.
some such other matters.
Okay.
What do you got?
So I just wanted to know at what point, I know the new
Can we invite him?
There he is.
Would it be okay to invite our brand-new director?
Once again,
Right?
I don't think I have the last name. I've got the first name, Kwesi.
He has been here 3 weeks, so he's 3 times smarter than when you met him the last time.
Okay.
Kwesi Betsarai.
That's yeah.
Betsarai.
Usually, when you come into public service, it goes the other way. You get 3 times.
Careful.
Yeah, okay. It's your show,
Okay.
Commissioner.
So I just went to the National Association of County Officials, and we had a ceremony for the 50th anniversary of the Vietnam War and veterans. And so federally, they have this commission that is honoring those veterans. So what I wanted to know is, would that be something you would be willing to look at doing in throughout Wayne County? And that would be looking at where those veterans are, which I was wanting to find them anyway, and maybe having some event to commemorate their 50 years. Because what I'm a veteran, but of course I wasn't part of
Vietnam,
the
right.
But what?
But it was close.
It was close. Okay.
Okay. And so what happened when they came home? They were not recognized at all, and so this commemoration is to now thank them for not thanking them way back, when. So anyway, I thought that would be something that would be great if we could put something like that together for our veterans.
That's not a bad idea. I think they'd appreciate it. So we can probably look into it and get some
And I
material
have
from
some,
you. There
yeah,
you
I
go.
have that information. So,
Right.
thank you.
You're welcome.
Well, they were recognized when they came home, but not necessarily in a positive way.
Exactly.
There was a lot of trouble if you were walking around in fatigues at that time in our history. Anything else, Commissioner?
No, that's it. Thank you.
Okay.
Oh.
Oh, and you did bring up. No, it's okay. It's going to take me a while on the last name, but I did get, after our last discussion, thank you for all the information on veteran suicides, but I'll send that around to my colleagues. I didn't do that yet, but there's a wealth of information in there about what's going on with that. Did you have something else today?
Did not.
Okay, we'll move the agenda then. I'm sorry.
So, I just wanted to, you guys might be interested in this. Livonia's hosting the Vietnam Wall, the traveling one, between August 8th and 12th.
Okay.
So I think it's at Rotary
Great.
Park. I'm trying to find out where it's at.
Yeah.
I believe it's at Rotary Park, but they've done a lot of fundraisers to raise money to get this in Livonia.
Okay.
That really is an incredible memorial there.
Yeah.
It took a lot of heat when they announced what it was going to look like, because it's so different from the other memorials on there. But the names and how people react to that, and they find their names on the wall and they do rubbings of them and leaving gifts for people at the foot of the wall next to them. It really has turned out to be an incredibly powerful memorial for Americans,
And this
given
is
all
a
of the
half-size wall that travels.
half size.
Half size.
Okay.
Yep.
So
All
can
right.
you send?
Yep. Sure.
Great.
Okay. Anybody else have a contribution here? All right, Mr. Clerk, where are we at on the agenda?
Item F, public comments.
Any member of the public wish to address the Health and Human Services Committee? Any member of the public? One last time, any member of the public? Hearing none, Mr. Clerk?
Item G, adjournment.
All right. Without objection, we stand adjourned.